Welcome to today's Candid Conversation. My name is Tony Boucher, and today I'm going to be talking with Zara Haji, who is a board-certified behavior analyst. She's been providing ABA services for individuals on the autism spectrum since 1999, and she is the founder of ABX Solutions, which is a company that provides behavioral interventions and services to individuals. For those of you who may be new to the term ABA or Applied Behavior Analysis, just think of it as a set of behavioral principles which help individuals to develop skills and achieve their life goals through the process of developing an increase in wanted behaviors or desirable behaviors and creating the environment where there's a decrease in those behaviors that are undesirable.
And all that. So it's how do you know that you've got a good provider? Like with even your own medical folks, do you Google them? Do you look up their reports? Yeah. And so it's interesting. Like other fields, we have a continuum of quality that you'll see in the providers. You have some providers who are amazing, have good what we call bedside manner, highly individualized and very attentive to patient care. So I think it's hard because it's in some sense there's no way to really know other than you had a poor experience and then you're angry and then you leave. Like you didn't feel like you were heard or whatever it was. And so for your older population, you have to keep in mind not only are you needing to make sure, do I have a good provider to begin with, right? Do I have someone who cares and is passionate about their job?
Listen to me.
Like just basic professional customer service type things. And in addition, you need to find someone who has applied experience. And so if you don't, what you may end up finding is what I would call like a mismatch in the sense that, it's important that the assessment protocols used for an older learner are not appropriate for someone who's a 3-year-old,
So you're saying that the tools that your provider uses are going to be, they're going to be specific ones for a 3-year-old.
Yes.
And they're going to have different assessment tools that really answer the questions and deal with issues that are age-specific.
Developmentally, that age range. And so if you've got a 12-year-old with a goal of statement of, filling in intraverbals or singing songs, then there's a huge problem there. Like, no, we're beyond that. Are we potty trained? Can we tie our shoes? Can we wash our hands? Can we greet people appropriately? Do we know how to say goodbye? So it's kind of, I guess the thing is, like if you're going in and, you need you need to see if you have a fever and then the technician puts a blood pressure cuff on you, they're not going to get a good read of what you need. So it's going in, your provider should say, okay, what are the presenting symptoms? Oh, you don't have any friends. Great, I have a protocol here that we use that can be standardized or non-standardized ways. It could be informal, meaning just questions or direct observation, or it could be something like a Vineland, okay, something more standardized. But you want to go in and you want the person to say, well, talk to me a little bit. What is it that's wrong? Or
I really love the Vineland.
Yeah,
that's my favorite. Incidentally, Jody Cholowicki, a colleague of ours, and I developed an assessment tool for parents to help choose an ABA provider. And so there will be a link at the bottom or at the end of this video for people to go ahead and access that, and it has step-by-step
okay, that's great.
Steps for you to help ask the questions about, choosing a provider that's a good fit for you as a parent and your child.
Yeah, that's awesome. Yeah. Good. Kudos to you guys. I didn't even know that.
Yeah, we developed it as part of a grant several years ago.
Cool.
So
okay.
It's a really nice.
That. But I'll look. I'd like to look at it.
I'll share that.
But other general things are making sure that that the child or the learner is involved. So for an older learner, another pitfall to avoid is not including them when it's appropriate. So if you have a 13-year-old who's got huge problem behaviors and they're within a normal IQ range, or they previously would have maybe called Asperger's before the changes. Please include them in the conversation. Like, what's going on, my friend? Like, kind of like you or I would want to be included. You don't want people talking about you behind your back. Hey, come to the table. Let's talk about what's going on. In a very neutral, non-judgmental way. Hey, what's happening?
A lot of times they'll just tell you, and it's funny because so many times I've seen where you know, when you do, you're like, did you ask them,
Right.
you know, what's going on? And like, oh, no, I didn't.
Yeah.
And sometimes they'll just come out and say, you know,
Yeah.
I'm really getting frustrated because I'm bored in this
Yeah.
class.
Yeah.
And, or,
Yeah.
you know, whatever the,
Yeah.
the case is.
Yeah, and it's so important to keep in mind that their perspective and the way they express themselves may be like totally different from the way you or I would, and that's okay. So sometimes, like I've had situations where you know someone will say something about what they don't like about the job, and like their supervisor had to give them feedback for being late, and like I just want to chuckle sometimes when I was like, well, that's very appropriate, and I'm sorry that it's made you mad, but you got to get over that one.
Yeah.
But you have to keep in mind, relative to everyone's their circumstance, that's a big deal for them.
It's really about being heard, though. It's really being heard,
and validated.
And validated
Yeah.
for their perspective.
Yes.
And then a lot of times, you know, if you ask, they're going to have good solutions for themselves. I think.
Yes, I
can't tell
agree.
you how many times when I've gone into a situation with my agenda thinking, okay, I think this is how we're going to solve this problem, and I ask the person, what do you think? And their solution is 10 times better.
You know,
and they buy into it.
Yes, that's
you know.
funny that you mentioned that. I've gotten a little bit better at saying, hey, so we have a problem. Help me come up with a solution, and allowing like a window of like, you know, yes, come up with some options here. What do you think will help you stay on track more or show up on time? Because I'll come up with my system and you may not like it.
Exactly. And you're not going to buy into our system as much as you are the one that you created.
Yes, that's exactly right. I agree. Couldn't agree more. That's good. But those are generally the things I would say is make sure you ask your provider questions like, why did you, like, it's always so good to ask, why are you using this assessment procedure? I always, like, when I go into doctor's appointments, I know I've had some experiences where I go in prepared to advocate for myself in a healthcare situation. Like, why are you running this test? You know, and
so it's really, as a parent or an advocate of somebody,
right.
You really need to know what the rationale is. Why? What are you hoping to get out of doing this?
Yes.
And making sure that that provider has really sound reasoning for it.
Yes.
That's in line with what you're hoping to.
Yeah, and what's in line with best practices as well. And one thing, if you have a provider who gets defensive when you're asking them to explain why you're using this tool, or what does this tool mean, or how does this translate to the treatment plan, that's probably a yellow flag.
Yeah.
And I love when parents ask questions. I love it, and I always reinforce that because it's so, to me, like a great indication.
They're the biggest like key in terms of like, is this going to be successful or not? In terms, I mean, you've got the person you're working with, that young person, and they're really key. But then the biggest support person is that parent.
Yes.
And so they can really make a huge difference.
Yes.
In the outcomes.
Absolutely. Family and parental involvement is a key variable to predicting long-term success, and so that is absolutely right on target.
Something I've seen a lot with ABA providers who are maybe just starting out and new at developing interventions is sometimes they one of the mistakes that they make is to jump in right away and start wanting to do therapy or teaching before they develop that rapport or that relationship with a person. Talk to us a little bit about why that's so important and what, in terms of, sometimes that takes a little bit of time.
Yes.
And so, can you address that a little bit? I know you've seen that as well.
Absolutely. And as someone, I'll openly disclose, I've had to use like therapy services to overcome some situational things, and it's interesting, like being on the other side of the table and watching like. Okay, your therapist, if you have counseling sessions, usually spends like 3 to 4 sessions wanting just to get to know you and associate themselves as a positive reinforcer for you.
So they're asking you a lot of questions.
Yeah, letting you do a lot of talk. Yeah, and they like want to know like what do you like, what you don't like, and they're not putting any demands on you. Yeah. Okay, so that's not even just part of ABA, or ABA, as a paradigm. Cognitive behavioral therapists do the same thing, you know. So it's part of just good practice with like developing a successful you want to bond with someone. So when you go in the field of ABA, most people will do what's called a pairing period, and that's for our little ones, where you just go in and you kind of do like, you bring only things that they want to play, you put no demands on them.
You're going to see bubbles and
bubbles,
crayons,
balloons, just fun games, edibles, a lot of things. But when you're like 12 years old, we're well beyond that. Developmentally, that's babyish, and and I have worked with some really difficult cases, Tony, where I'm like, I have tried everything. I've gone
to pair with them.
Oh, like I have like 15-year-old. I've gone off and run off and gotten the latest version of Battleship, and I had a moment where I realized, I like a light bulb. I'm like, I just need to follow this person's lead, because I'm like forcing.
I love it.
Yeah, I had a moment where I'm like, okay, what do you like? And I'm running off to buy the latest clothes.
This is huge.
Yeah.
Say it again. What for our older folks?
Yeah.
To develop that relationship.
Yeah. Follow their lead.
Yes.
Yeah, I mean, unless they're doing it, as long as they're doing anything
As
illegal.
long as they're not breaking windows.
Yeah, as long as they're doing anything illegal, follow their lead.
Yeah.
Like, we have a tendency to over talk.
Mm-hmm.
And like, if you're like me, I'm uncomfortable with silence, and like, and like, you have to realize sometimes they need time to like let them initiate. So if you want to walk it for a few minutes in silence, you don't have to fill the void and feel like obligated to talk and be like, oh, look, I love winter. Do you like winter? You can just walk next to the person, and that can be enough, and let them make a comment. Oh, look, there's a bird. Great. They like birds. Comment on the bird. And I learned that sort of through several years, like follow the person's lead, and that's so much more successful for me with that pairing. And the whole thing about the relationship is some people, some kids who are older, the 12, 13, 14, take to you right away. They're just, like, for example, if I'm working with like a 13, 14-year-old female, and like I naturally like some things that she may like, she likes pop culture music, like do you like Katy Perry? That's a real easy pairing process.
So you can talk it
real
interest.
Yeah, and then she immediately will sync me in with, she likes the same things I like. We can do it together. I like her. So it's a very easy association. Now, for some kids where there's more complex things going on, you may need to take a whole month, a whole 4 weeks of just very low demand, no demand really, of...
That's really important, because I think, like some of the new ABA therapists come in and they're like, I have to get to work right away.
Yes.
And the idea of spending a month just really allowing a person to feel comfortable with you may feel really counterintuitive, because you're not working.
Yes.
But it's really crucial, because if you don't have that relationship fostered, the teaching, the skill development will never happen.
Yeah, and if you think about, like, so for, like, if I do, like, some CBT sessions, I may do them for, like, 8 weeks, right, or 10 weeks. Most ABA therapy lasts 12 months
You're
to...
not a cognitive behavior therapist.
Yes, sorry. So most ABA therapy intervention will last anywhere from, depending on your situation, I would say on average it's going to last anywhere from a year to 5 years or multiple years. So if you think about that 1 month, that's just a little bit of time you're using to establish a solid foundation, like the foundation of your house, so that you can build up and end up with a beautiful product. And I think that's a really good point you make, to really talk about that. Like, it's okay to give yourself 4 weeks to, hey, you didn't know this person, they don't know you. Like, most of us have friendships that form over years, and you're trying to force it within 2 weeks. Yeah, just take your time, and especially for the older groups, because they're already hesitant.
They have so much baggage,
Yes.
A lot of them going on in their lives. And I recently worked with a person who we spent 2 months really just having very minimal demands and really just developing that relationship, because he'd been so burned. As a child, I mean, he really had had a lot of punishment where he wasn't able to do things, and he needed to really feel safe and trusting of the relationship.
Right. And that's a good point that you bring up. So when you're working, so if your child is working with a therapist and they've had successive negative experiences with any type of adult therapist, so as soon as that new person comes in, all they see is, this is another adult walking to the house here to help me. And I automatically put them in a category of, I'm going to put them over here because they're just another adult. And that person could be possibly the best fit for your kid, but because your child's had this, sequences, and that's common with anything, like teachers, like if they've had several bad teachers, like every teacher's like going to be that.
You're raw, you're kind of sensitive, and you'll react to that.
So which is why, even more so, it's important to, and I'll actually give you a really quick anecdote. I recently went and met with a 13-year-old who's just going to middle school, and so she's in need of some, therapy to help with some of her just some anxiety, and then also friendship sort of stuff. So I went to the house because I always do like what I call an informal meet and greet, because I just want to I always tell people, like, this is like a marriage, and you want to make sure like this is a good fit, because I'm going to be in your house a lot, and if you don't like me,
it's not a good thing.
Yeah. So probably on your interview checklist, do I feel good about this person?
Yes, exactly.
Yeah. So,
and is it okay for them to spend 20, 30 hours in your home?
Yeah, like anything more than an hour, I'm like, you want to make sure that's a good fit. So go in, and mom was great. It's always real easy conversation. And the 13-year-old comes in and slumps over, kind of rolls their eyes, and I just inside like kind of chuckled a little, because I was like, oh, I could see some of myself in that attitude there. And part of me wanted to jump right in and just start like, so what do you like, blah blah blah. And I just was like, I just looked at the mom, because like sometimes I think the parent has an expectation that I will wave a wand and magically engage their child, and that's not at all how it happens. It happens very subtly. I just sat there for about 7 minutes, which seems like an eternity. You talk about the silence, which I'm already uncomfortable with, and just kind of looked at the mom and made a few comments with mom. Didn't at all engage the girl. I just let her do her thing. She was leaning over on mom, and so finally she starts talking about hummingbirds, and then that was my lead. That was me following her lead, and I pivoted back and said, "Oh my God, they're beautiful," and kind of went with that, and ended up. She liked me finally. I got the sense that she liked me at the end, and mom was really positive, and she was like, I can't believe she actually went back and forth with you. You guys had a little conversation, and it was really nice. So it was really nice to allow that to happen, but it's really interesting because it is challenging to get that rapport sometimes with older learners.
Yeah, and you can't force it.
No.
You really can't.
No. Sometimes I'll have parents just outright tell me, like, that person just not going to be a good fit for my kid, and I'm like, yeah.
If that's the case, it. You have to.
I think we have all had experiences with doctors. Like, I just don't like that doctor. I don't like his personality. Don't like his nonverbal gestures.
It just doesn't feel right.
And that's the same with ABA providers. So you have to kind of take that into consideration. So older learners, there's a lot of other things, but the great outcomes though. So I have a couple of interesting stories I'd love to share with you if you'd like.
Yes.
Okay. I'd love to give an anecdote to just maybe use as an example of kind of a start to finish sequence. So just to offer some insight into the process. I think it's always helpful, because when you see like the beginning, and then the end, we don't always get to see the end product. We just see. And so I have a couple of cases where I've started working with kids before that 12-year-old mark, like right around 10, 11. And so I have a couple of kids right now around 16. And so they're in that age where they're not yet at that adult outcome that we've been talking about, that be the transition piece, but they're older learners now. And so their baseline coming into me was, severe problem behaviors, and we're talking like the property destruction, threatening to kill people, threatening to kill themselves, huge property destruction, one getting kicked out of school because it was horrible and institutionalized, and so baseline for them was like they were trying to harm the ABA team, because they're like, you're just another adult, So when we come in, they're 11 or 10 and a half, 11, like our approach was very much, okay, this kid has a horrible history with adults delivering instruction. We've got to totally undo that.
And that's your first step. The history.
Yes, that was my first step. Is I've got to undo some of what the public school system has done a little bit. Although there were some really great teachers, so I want to.
But just in this case, you're saying it wasn't a good fit.
Undo all of this and kind of come back in and just be like, hey, like I want to help you. And you're 11, so you're not quite where you would be for transition planning, where I can have a real serious conversation with you about, like you act this way and you're going to be put in jail, but where they'd understand it. But have I just spent like the first 6 months were just like desensitizing, almost like trauma. Like if you've been in a trauma experience where like you're not going to get back on that bus if you've been in a horrible car accident, you don't want to get back in that car right away. And it may take months to where you feel comfortable. So it's kind of undoing that. For them, it's like a little trauma. Like, I hate you guys because adults give me things I can't do and don't understand. So you're in that category and I don't want you near me. So it was 6 months or so of just like, oh my gosh, we've got to de-escalate and be like, just tolerate being around us, you know? And then we were able to slowly get into, because if you don't have a child who's willing to cooperate during assessment, you're not going to get an accurate read on their skills.
You don't know what they can do.
Yeah. So, you know, at that point we've got old reports, and so, you know, we're basically at that point, after like 6 months, able to then finally go in and be like, okay, let's work on sounding out, because reading is important, and you have the capacity to read, my friend, and you need to read so you can access the world. So we went through slowly just building up his treatment sessions, where there was like 20 minutes work and most of the rest of it was fun. So we sort of started flip-flopping that based on, you know, percentage of minutes that were adult directed versus child directed.
So a little more demand.
Yeah.
And you were just kind of increasing
slowly
the
edging, it needs to be painless. It needs to be painless. So we did that, and over the course of between the time the kid was 10 and a half to 12, we were able to not only regain instructional control and actually have a positive relationship to where he wasn't screaming when we came over. We were able to get an accurate assessment, get a clean baseline, and start teaching him how to read.
How did the parents deal with this? I'm putting myself in this parent's shoes and thinking that sounds like a really painful process for them.
Painful is an understatement.
Did they just know where you were going and what you wanted to accomplish with their child, and so they just let you go ahead and do it?
Yeah, so one thing that I do is when I go meet with parents, I have a very open conversation where I go ahead, because we know, you know, when you're a behavior analyst, we know enough about patterns of human behavior where we can give like somewhere within about an 80% projection of what we think the prognosis will be. Like generally, like, okay, we got problem behaviors, it's going to take about this much time in general with an effective intervention to undo some of this. So I kind of go in and say, this is what it's going to take. Are you ready to sign up for this? And so you said painful, which I feel like is generous. I think it's emotionally distressing for a parent to hear their kid cry and like say things like, I want to kill myself, and there's no demands going on. It's just that's their way of getting out of the task demand because it worked in school. And like in having the, you know, parents sit outside the door, and I don't at all blame that parent. It's hard to hear your child cry. Regardless of whatever age they are, and so that was painful is a generous word. I think it was emotionally distressing. But then finally, you know, I remember we had a moment where like we all wanted to hug each other, like we were like, oh, he likes us. Like he was actually smiling when we arrived, like at like, you know, the 7th month mark, and the mom was smiling, and we're like, yes. So the one thing I would like, I'm glad you brought this up, is tell parents, ABA will work. Effective ABA will work. It's based on progress monitoring, but don't give up. Like with a good weight loss program, if you don't lose 10 pounds the first week, it doesn't mean what you're doing isn't working. It may mean you're losing 1 to 2 pounds a week.
It may just take longer than you expected.
Yes. So don't give up. Just make sure there's some progress monitoring and data collection to show that it's getting better faster. Like the duration is coming down, or the frequency, like that needs to be steadily coming down. And
you can see that.
You can see that on a graph.
That's your a competent ABA provider is going to be able to look at the data that they're collecting with your child and say, okay, I can see we're making, you know, progress. That behavior is decreasing, or this one is increasing. Even if it doesn't feel like it in the moment.
So what I did with this particular case, at around 12, about 18 months into treatment, so I kind of led a lot of it. I was programming based off of, you know, using what I call routine analysis, functional assessment tools, direct
observation.
Just
determining what the behavior, what the payback is for the person, like why they're choosing to use that behavior. Give them something.
So I initially did like a functional behavior assessment, looking
figuring out
why are you doing this. So we did all that, and then I started that point, like I said, I was able to get an accurate read on him. So for about 18 months, I kind of led. The mom had no idea. She's like, he hasn't had any effective instruction. Like he's basically just been, you know, in the principal's office for like 2 years of last 3 years of life, I don't know what to do with him educationally. And so I kind of dictated that using multiple tools, came up with really functional, because we knew he needed a functional outcome, that like he would be able to work like somewhere.
Can you give some examples of what some of those were for him?
Yeah. So basically the ability to read, okay, to decode words and sound out words and read words. And so he had the capacity to read because his IQ is, right around 75. Okay. He can certainly read. Yeah. But he had struggled because he was put in gen ed originally. He couldn't stay on pace.
Education wasn't the place where he could learn.
No, he needed slower rates of instruction and a lot of repetition. Okay. And so that was one thing for me where I was like, we need to teach him how to read because reading will open up his world.
Doors. Absolutely.
Absolutely. Like there's like that's the one core skill. Everything. If you had to pick one academic, teach your child how to read if they have the capacity to learn that. That's where we started. It's like, I've got to teach him how to read. And that's one thing we started. And then there was other things like, his room is always a mess. Like things like really functional, like couldn't do any chores. Things like that. He couldn't tell time. He couldn't deal with money. But he liked to buy things with money, but he couldn't deal with it.
So he had the motivation.
Yes, the motivation was there, which was helpful. So those are examples of things we immediately started targeting. Friendship skills. He wanted to be around friends. He's like the child on the playground, the perimeter of the playground, looking in, but doesn't have the key to get inside the door.
He wanted to. He just didn't know how.
Really good skills. And so we systematically just started, I'm just like, okay. And then at 12, almost 13, I sat down and we did a full team meeting where he was included. It was a little awkward for him. And I had a planning sheet, a large visual that showed those domains like social skills, communication, where do you want to live? And I have like some informal questions that help guide to an answer. And we sat there and like large board that we all could write on, and I said, let's write on this. We're going to figure out what is it that right now you want to do. Let's take a baseline right now. And I told him, this is going to help me develop your treatment plan. And I said, my little friend, the three of us, your treatment team here, are only here for you to help you succeed.
So you're really at that point when he was ready to sit down and have the conversation.
Yes.
You were beginning to teach him to direct his own care.
Absolutely.
Which I think is really crucial because I work with a lot of adults who, that's a big process that I spend a lot of time teaching them how to be my boss.
Yes.
Because they're the ones who are in charge.
Sabotage to practice. Yeah.
So absolutely. So you're starting in this case with this young man, teaching him how to manage his own care.
Yeah, and keep in mind it took us, at this point we're about 24 months into treatment.
Yeah.
And so if we talk about like just the span of time, like change doesn't happen. Meaningful change does not happen in 6 weeks or 8 weeks. Yeah. This has been a very slow process. So,
but he's 16 now. Is that right?
He's 16 now, and so we've gone through the sequences of every year we sit down, and so I gauge and I ask him. So what we did is we matched the treatment plan goals. So he talked about where he wanted to go. He wanted to work at GameStop. Okay, so there's some basic voc rehab skills we all need, like showing up to work on time, clocking in, that you need at any job, listening to your supervisor, following a multiple step direction list. And so we went into the community and were able to work with a local movie theater and give him on-the-job training at a younger age. And so we had very explicit skills, like he has to go sign in. And so we taught him how to sign in. We taught him banking skills because he's like, I want it, because he loves using money. So that's great. That's a great motivator. That's actually a blessing.
Yeah. And these are the kinds of skills, like traditional school focuses on, learning your multiplication and your calculus.
Standards,
and math skills, functional math skills, are learning how to deposit your money into the bank and withdraw it when you need it.
Using an ATM, sliding it through like at a self-checkout at Walmart. So he told us very clearly. So when we got past like the first 6 months and we started putting some demands, and then we started letting him co-pilot with us and like, tell us what you want, because we want to help shape your outcome. We want this is your artwork. We want to draw it the way you want it. And then like a whole different child came out where like we're not aversive anymore. He likes us coming over. He knows what we're doing. We're working on a lot of the things you just said because they all are part of that roadmap. The person-centered planning. He wants to be able to potentially live in an apartment with a roommate. So we talked about right now working on budgeting. What are realistic budgeting? He has to work on creating invoices. Like he has little timesheets he has to create. So these are things he's he's doing at 16. He has. I think he probably has better banking skills than any other
21-year-old who graduate from high school.
Absolutely. Like he had a little ATM card at 15.
Yeah.
You know, he has probably better banking skills than I do.
That's a great example, though, of starting those skills early, young, and making sure that they're established.
Yes.
By the time that he's ready to be out on his own, it's not gonna be the overwhelm for him. He's not gonna go and blow all of his grocery money every month on buying video games.
Absolutely not. Exactly.
He knows how to do it.
Absolutely not. And then more recently, we've been able to transition him to another job training because he has a year experience at this other side. He's able to gain another day at another location, like at a pizza joint. Right. So he's going to get another diversified opportunity. And so we've gone from a kid baseline who was property destruction, threatening to kill himself, hiding under tables, to a kid who smiles, actively involved in treatment, and wants to work.
And he's got a resume.
He has a resume. He wants
jobs.
Yes, he wants to work, and he wants to make his own money. So for me, like, you know, we're still in the middle of that, getting to that adult outcome, but his current trajectory is positive.
So much better.
Yeah, because if we had been going on the same when he was 10, like, he would probably been institutionalized by now. And so it's just been so rewarding when we see that, because I'm like, he deserves to have a positive quality of life, and that's what we're going to give him.
I really think the important thing here too is it's like he doesn't necessarily have to go to college.
No, not at all.
To have a fulfilling life.
No.
But, you know, our folks on the spectrum can have rich and fulfilling lives.
Absolutely.
This is not a maybe. It's entirely possible with the right supports in place.
Yes, absolutely. And I think one thing that, like I mentioned earlier, it's important to think, like, we as like a typical or higher functioning adult, whether, you know, you have any other comorbid issues, we have an expectation of what we envision quality of life from our perspective, meaning our quality of life means we have a job, we have a boyfriend or husband and kids. Keep in mind, the friends we work with, they have a different perspective. A good quality of life for them may be getting to play on their iPad. They may not understand that, oh, I should have a boyfriend. That's not a social
it may not be
rubric for them. It's not a part of them, and they may not even understand that. So for them, they're happy having pizza at night, being able to make their own pizza, make their own meals, and being there. That's what they want, you know.
And the last time that Temple Grandin came for the South Carolina Autism Society, she told me, I get the stock market, I get the financials, I don't get romantic relationship. And for her, like,
I read one of, it's so funny, I read where she was on like a flight next to a couple that were flirting with each other, like all the like the nonverbals, and she couldn't decode it, which I think was it's so great.
Yeah, I mean, for her, what gives her meaning and purpose in life is doing the work she does as an advocate.
Yeah.
And as a person who, you know, does her animal science work. And that's meaningful for her.
Yes.
And I think, you know, as parents, a lot of times we think of that, you know, I want my grandkids someday. And we may have to revisit that.
Yes.
We may not, you know, that may not be in the cards for a child.
And it's also meaning that your kid is okay as long, you know, like, so you may have to really understand and put your like perspective and to their perspective and saying, okay, for some kids who are really low functioning and maybe severely impacted, it may just mean their basic ADLs are met and they're happy. Like, they have.
And really, I've known lots of folks like that who are happy.
Yes.
And that's okay.
Yeah.
And a lot of people that I talk with, actually, one of the things they say is, you know, I don't want to have those expectations that, you know, other people have.
Right.
I don't want to be a doctor. I don't want to go to college.
Right.
I want to be me.
Right.
And I don't want to have goals. I don't want to reach this potential that society says I should reach. I just want to be able to live my life in peace and happiness.
And that sounds like a lot of people, like typical people I know, whether they're it sounds like a family member, actually. Absolutely.
And it's okay.
Yeah.
It's okay. I mean, not, you know,
that's
everybody
normal,
should
though.
have that right to choose their path. And if you want to reach some potential that's out there and be a person who moves towards goals, that's great.
Yes.
A lot of our folks do.
Yes, absolutely.
And some of them don't.
Yeah.
So,
absolutely.
And a lot of our folks do want to have the boyfriend or get married.
Yes.
But not everybody does.
Yeah, absolutely.
That's not a sign of quality of life for them.
And I think it's also, and I think it's for parents, it's scary, like thinking about if you have a child who may have some sort of disability, about thinking about those sort of social relationships, and
it's
very scary about
is,
you know, that's probably a whole other conversation, but that's your child's rights, and as they get older, that is probably a whole other conversation.
And actually, we're going to have a disability lawyer come and talk.
Nice.
And we're also going to be having Hector Salazar, who mentors in his business, and we're going to have a little forum where we sit down and talk about the whole employment piece.
Yes, and I think I knew a little bit about that. Blake was a little involved. Yeah, I know Blake really wants to help set up like a center and like a training center, because we definitely, that's something, I think if we could change one thing, it would be that skill, because having a voc skill that's employable is huge to accessing and opening up other things, like having your own money to do stuff. So I think
but your piece of it is really crucial, because
it's getting getting us there.
It's getting you there.
Yeah.
And the exciting thing is that it's not like you know, for our individuals today, they have that support through age 21, which is
right. And one thing I wanted to quickly mention for any parents who watch this is that, so school, you know, if a lot of us who have children with IP may use the up till 21, which is, you know, your legal rate, and that's great if that makes sense for your child and for your family. One thing to remember though is, like we talked about, the need to plan. So at 21, like when like 21 and like it's like the 22nd birthday occurs, be prepared. I mean, if you haven't planned, it's going to be shocking at some of the discrepancies that school can mask. And one of them I know we spoke about off camera was the social piece. Yeah. And that's huge when we talk about higher functioning kids, or kids, they may, when I say higher function, the capacity to understand and have meaningful relationships, and IQs that are generally mild or higher.
I tend to focus people on looking at what their splinter skills are. Because they're such an, you know, it's interesting to see
that's probably a better way.
How many people, like, what is high function?
I know, like that's abstract, right? Like, really, does that mean IQ, or does that mean that you can talk? Yeah, you're right. So
that's my little thing. Splinter skills.
Yeah, that's actually good. That's actually really good. So one thing that I noticed is that, and you probably know this, is that individuals with autism, like previously Asperger's and high functioning autism, and we'll leave it at that, they are higher risk of getting depression. And so one thing about that is, first of all, do you have a meaningful quality of life? Just like any other person, do you have something meaningful that you prefer to do, whether it's your work, your downtime? And so when your child leaves school, you have to also remember, like, school also serves a huge social role for kids. And it could have been just incidentally, where there was lunch, going to specials, doing like little text messages, and when your kids getting out of school, that's going to all quickly fade off. And what I've seen happen, which has been unfortunate, is the child immediately fills that void, because, you know, unlike, you know, what some people make the assumption that children with autism do want to be social.
Yes.
It's just having the right skills to access it. And so they immediately miss it. And if you haven't proactively taught social skills, like, how do I find friends? Like, how do you and I find friends, you know?
So you're saying that in school, there's kind of an artificial environment there.
Yes.
Where they have the opportunity to be social, because they go to school every day, so they're not having to initiate the things
it just
that
happens.
you and I do out in the non-school world. So once that school piece disappears, they're kind of like hanging on their own, it's not happening naturally.
Yes.
And so it has to be created or
should have been
orchestrated.
Yes.
Okay, or the skills need to have been
taught already. So, like, does your kid know how to go on Google and go to, like, find, like, can they go to, like, do they know how to, like, find meetup groups, or do they have a hobby where they could go start, like, doing something, like going to meet with a once a week writing group, an art group, a photography group? How do they do that? Did anyone teach them to do that? Because if not, guess what? They're going to fill that void, and it's going to manifest itself as, you'll either see an increase in problem behaviors, or what they'll self-report as depression. I don't feel, or, you know, maybe not, but it'll look like depression. And they'll feel unsuccessful. They'll be like, I I believe myself to be successful and now I'm not, and whoa, that's huge, because that impacts voc behavior.
Yes.
I mean, you and I know a typical person, if you got the blues in one aspect of your life,
you can't get up,
it carries over.
Yeah.
It carries over. Yeah, it always carries over. So this one important thing, if I had to like leave with something that I really want parents to do, is like, please plan before, and plan very carefully, and social skills or social domain is the number one area where kids usually fail, and that would prevents them from thriving when they leave school.
So they need to have real specific, concrete steps that they can take once they're out of school that actually continue on with these relationships, or build new relationships.
Right. So a pivot skill that I know how to do this at school, now I can go do it as an adult. And I think that's huge, because that impacts quality of life, which I'm big on quality of life. So and everybody is entitled to have a meaningful quality of life. Yeah. So
that's more important than whether we can get good grades in school.
Absolutely.
It's the quality of life.
Absolutely.
So people feeling safe and happy. And
Who wants to be miserable every day?
Yeah.
So yeah.
Well, this is great. Do you have anything else that you would like to share? Or?
I think we've done such a good job, like talking over like everything from like the insurance to assessment to what to look for in providers, and a couple of success stories. I think we've covered a lot of good information, and hopefully will be helpful to people listening.
I'm so thankful that you
thank you
here today and have this conversation.
Yes,
and
absolutely.
thank everyone here for listening.
Yes, thank you.
Thank you for spending your time with us today. And if you liked today's candid conversation, you might also like my new book, Autism Translated, which was written with the help of my daughter and hundreds of individuals on the autism spectrum to help you create a better connection with somebody that you love who has autism. And one of the really exciting things about this book is that 100% of the proceeds from the book during our launch week will be going to help support individuals on the spectrum who are receiving mentoring services through Mainstream Studios. And finally, if you are one of those parents who are really motivated to help create a roadmap for your son or daughter, then get in touch with me. I'm going to be having a VIP day where we're going to be creating life plans for individuals on the spectrum, and I would love to talk with you about seeing if that is going to be a day that you would spend with me that would be a good fit for you to help put some supports in place and get things headed in the right direction for your son or daughter. So get in touch with me if you have any questions about that, or if you have any questions about anything else autism related. As always, I love to hear from you. Take care.